Right, let's look at this breaking story now. The Free State Department of Health has confirmed a second cholera death in the province. The patient is a 42-year-old female from Parys. She was admitted at Boitumelo Hospital in Kroonstad, where she succumbed to the disease. Free State Health spokesperson Mondli Mvambi is joining us now for more on that. Mondli, good to have you, and thank you very much for your time. Just the details of this latest development. Can you confirm indeed that another cholera-related death has been now confirmed in the province?
Good evening, and good evening to all the viewers of Newzroom Afrika. Yes, indeed, the Free State Department of Health can confirm that a 42-year-old female from Parys, who lived in Parys, demised at our Boitumelo Hospital in Kroonstad as a result of a positive test to cholera, a laboratory test that is proven scientifically. So we have a second death, unfortunately, in the province at this point in time.
Any idea of the travel history of the patient at this point in time?
Come again?
The travel history of the patient at this point?
No, there's no indication of a travel history of the patient beyond the two areas, Parys and Freedefort. So we know that the patient had at some point been to Freedefort, and we know that they lived in Parys, and eventually they were admitted at our Parys hospital, where when they were complicating, they were then elevated to higher level of care facility in Boitumelo, which is in Kroonstad, where they unfortunately passed away. And upon passing away, tests were then commissioned, and the results came, and they proved positive to cholera.
Is there a geographical link, maybe a regional link between this death and the one previously reported in the province?
Well, the previous one that was in the province, no, not personally, but geographically can be, but that does not also talk about the same source. It could be different sources. So they are from the same vicinity in the area of Freedefort, in the Mwati municipal area. So it is possible that they may have come across similar sources or different types of sources. Anything is possible there. We cannot definitely say for sure if they are directly related.
Yeah. And how are the efforts to track the source of the cholera going within the province?
Come again?
How are the efforts to track the source of the cholera within the province going?
Well, efforts have been going on, and we've been getting assurances that there's multidisciplinary teams that have been at play. The Department of Water and Sanitation working with COGTA in the province, with the municipality as well. Those are departments together with environmental health officers. Those are competent people to deal with it. As the Department of Health, we've been on the side of ensuring that we raise awareness in the community for purposes of health promotion, for them to prevent getting sick from when they come into contact with any possibly contaminated sources of water. We ask them to boil the water, to treat the water with the bleach solutions within the households, to have that water within the household for various uses as readily treated, so that they don't take it for granted and get infected by any untreated water, either for any household use or for even drinking. We have asked the people to constantly wash their hands whenever they are to handle food, also for hygienic purposes when they are from using the bathrooms, and to treat any water basically as potentially suspect, so that they are preemptively protected. So that's our work, and we've been going to schools, we've been going to all settings within that community, just to make sure, even beyond that community, the entire province, because we have declared in the past that ours is a province at the heart of a country. We have 5 national key roads passing through the Free State. We are surrounded by 6 provinces plus the Kingdom of Lesotho. So we remain, on high alert, just to make sure that we do not get external infection, but also we do not transmit infections to other parts of the province, but also within the province itself will contain any potential spread of the scourge of cholera outbreak.
Now, Mondli, one of our reporters was there earlier today with the gift of the givers in the Ngwate and Parys areas, Ngwate local municipality in Parys and Vredefort. And one of the things that come out of there is that there's general consensus amongst the people there that there are more people who could have died there because of cholera, but the statistics are not reflecting that. What's the view of the province on that?
The proof of cholera is not based on opinion. It should never be based on opinion, because as we have been educating the public, some symptoms that people present of cholera and those of diarrhea almost similar, to a point of not being easily distinguishable one from the other. So we appeal to the public, use scientific-based methods, which are laboratory tests that will come out. Because at some point, there was a person who, presented with symptoms of diarrhea. They were treated in our health facility, swabs taken, and the person tested negative to cholera. So it is not an equal sum of that if you've got diarrhea, necessarily you will be testing positive to cholera. Now, we are warning we are actually urging the public and those that are in the know to be responsible about the information they have, and not to cause unnecessary panic within the community, but to make sure that they guide people. And we don't play one, public institution against the other. We work together instead to manage the situation as it is there, and work on science-based evidence that will say this is what it is. And at this point in time, based on laboratory results that we have 2 deaths that are attributable to cholera in the province.
Yeah. Some of the answers that we got earlier on today seem to suggest that people don't have enough knowledge and information as to, for example, why you're telling them to boil the water and add bleach. They're saying they're not even quite sure of the efficacy of that, and I suppose the dangers that are associated with consuming bleached water.
We always know with any diseases that are as old as old itself, that it is never 100% that everybody will agree that they understand the messages or they embrace the messages after understanding them. But we continuously soldier on to make sure that we use every available opportunity, be it mass media, be it person-to-person communication, be it community education. We raise awareness at every level avenue that is available at our disposal to make sure that we spread. For instance, it's not massive cases. It's not everybody in that area who is getting infected with diarrhea to start with. So that would point to the fact that little as we may consider it to be, some work is being done, and a number of people do imbibe that information and they put it to good use. Those who get infected, however, we are not discriminating against them because we do not know what the sources of their infection are. And we cannot cast aspersion on those people for the fact that they're infected and attribute any level of knowledge or not. We punt information out there, we put it out there, we go to schools, we educate, we raise awareness. We do not take it for granted that it is us who will be bringing that developmental information to people. We engage with them, we understand their own ways of coping as well. How do they understand their mechanisms that can work best for them? Because we are not bringing foolproof solutions, but we are bringing solutions that people can embrace and make use of them. So we believe that work will never be enough, but work must be continuous and it must be done, and that's what we are doing.
Mondli, I appreciate your time. Thanks so much for coming on this evening. That's Mondli Mvambi speaking on behalf of the Department of Health in the Free State.